What happens when people don't have enough fat to have a Brazilian butt lift?
Well, that's why consultation is important. So, and some people do have enough fat, but they have so much skin, you can't retrieve the fat, right? So during consultation, we look for fat. We look at your deltoid areas where a lot of people have fat, inner thighs, saddlebags, abdomen, back, and so forth. And sometimes we have had patients who have had, again, not enough fat. And what do? Then you rely on implants, right? So there are good implants around. They are implants that are specifically made for buttocks. They are solid silicone implants. They come in an oblique shape or a round shape. I usually prefer the round shape, but it's for different people. When you want to when you have a longer shaped butt, you can use an oblique shape. Or elongated shape, and when you have a rounder butt, you use a round shape. So different implants for different people. They have different sizes, and we have them in the office, and we try them. And then we do buttock augmentation using solid buttock implants. Most surgeons place 2 incisions, one at the corner of each butt in the inner aspect, and through those incisions they go in and place the implants. I like to create only 1 incision, and usually it's within the crack of the butt, and through that single incision I go in and place both implants, one on the right, one on the left, of course. And then implants can be placed under the fascia. What is a fascia? Fascia is the covering, the connective tissue covering over the muscle. So they can be placed over the muscle under the fascia, or it can be placed inside your gluteus maximus muscle, which is the main muscle within your buttock. So it's intramuscular when it goes inside the muscle, or it's subfascial when it goes under the fascia. And those decisions really have to be made with the patient. They both have pros and cons, but ultimately it's the patient's decision. I like the subfascial plane a lot more for most patients. It's more comfortable. The intramuscular can be painful. And you have to be careful when you do this surgery because there's a big, huge nerve known as the sciatic nerve, and hence sciatica, that is underneath the muscles. So being over the muscle is a safer plane. But I've done intramuscular, I've done subfascial, and I always come back to the patient and say, hey, it's not just about your butt, it's the back view, okay? So some people have really not a lot of fat, but they still have love handles, not enough to make your butt bigger because it's not much fat, and they still need enhancement with implants. So I always say, hey, let's look at the whole picture. The whole picture is your whole back. Let's use implants and still liposuction the areas, the surrounding areas, so we create a beautiful frame for that beautiful picture. And then you can also do combination, whereby we've done that we place the implant and then we go and place fat around the edges of the implant so that the implant becomes less visible, noticeable. So that's always a good strategy to perform when there isn't enough fat.
And how old do you have to be? Is there an age range that's more ideal to have the procedure? Or
for Brazilian butt lift?
Brazilian butt lift.
It really has, for plastic surgery, let's talk about plastic surgery. What's the ideal age for plastic surgery? There is really, number one, the younger you are, the easier you recover. So we talked about surgery and recovery. Obviously, the younger you are, it's easier to recover, it's easier to heal, you heal faster, and you get a better result. Then the second thing that is important is your medical history. If you're a healthy person and you're 200 years old, you can still have plastic surgery as long as you have no medical issues. And that's why we send all our patients back to their primary care physician or a primary care physician to assess them, to determine that they can tolerate a 5 or 6 hour or a 3 hour or a 2 hour surgery, and then give us a feedback. Yes, it's safe to perform surgery on this patient, and then we proceed. So medical history is important. Then the third thing to evaluate for liposuction is tissue laxity. Obviously, a younger patient has less laxity of their skin than an older patient. They have more elasticity, as the younger person has more elasticity. So if you liposuction them, their skin shrinks better, it contracts better, so they get a better result. If you liposuction an older patient, they already have some skin laxity, and when you liposuction them, you can potentially make that worse. So there is really no age limit, but you have to see the patient and assess their tissue quality.